Early warning signs of osteoporosis, 7 possible symptoms. Introduction. Mark your calendars for the 20th of October 2024, World Osteoporosis Day, a perfect time to focus on your bone health. Osteoporosis is a gradual weakening of the bones or loss of bone mineral density. In this article, I'll walk you through the early warning signs of osteoporosis, 7 possible symptoms that you shouldn't ignore. In the UK, around 50% of women over 50 will experience a fracture due to low bone density. Each year, there are approximately 180,000 fractures attributed to osteoporosis in England and Wales alone. Hip fractures are particularly common. They are linked to other higher death rates in older adults. Importantly, we'll also look at common risk factors and natural ways you can prevent osteoporosis and minimise further bone loss if it has already begun. You may also be interested in this blog, Menopause Joint Pain 8 Management Strategies, and my one-to-one service to support musculoskeletal health. Early warning signs of osteoporosis. Number 1, frequent bone fractures. A major early warning sign of osteoporosis is a bone fracture from a minor incident, such as a fall from a trip or a simple bump into something heavy. 2, persistent back pain. Does osteoporosis cause pain? Well, although osteoporosis itself doesn't cause pain, fractures from weakened bones do. The pain of a vertebral fracture would typically be long-lasting and made worse by movements like coughing or twisting if the spinal vertebrae are weakened. Compression fractures are common in the mid-back. Instead of a rectangular-shaped block, the vertebra collapses at the front and resembles more of a wedge shape. Low back pain that doesn't go away, particularly if you've received treatment, is a warning sign. Pro tip: if pain persists or you are in doubt, get a private DEXA scan. You can book online. Number 3, height loss. This type of collapse can lead to a gradual loss of overall height and resultant stooped posture. You may have seen this in parents as they have aged. This loss of height is often caused by loss of intervertebral disc height and spinal compression fractures. When looking at the spine from the side, you may be able to see a marked forward bend to the spine at a particular point. 4, posture changes. Check for a stooped or hunched posture. As the vertebra weaken, the spine curves forwards. You may also notice extreme discomfort or inability to flatten your spine on the floor. Pressure at the apex of the curve may cause sharp pain, made worse by movement. Pro tip: work preventatively to keep your posture upright through your 50s and 60s with yoga and Pilates and other postural alignment classes. 5, weaker grip strength. Weaker grip strength and or reduced muscle strength can be an early indicator of bone mass loss. Studies have shown a strong link between poor grip strength and low bone density. 6, brittle nails and fingernails. Brittle nails or brittle fingernails may be a sign of vitamin D and calcium deficiency, both of which are essential for healthy bones. Brittle nails may be a subtle sign that a person's bones are weakening, especially if other symptoms are present like ongoing back pain, loss of height, worsening posture, and other risk factors such as a processed diet, chronic digestive problems, a family history of osteoporosis, or early menopause. 7, dental issues. There's a lot of evidence linking osteoporosis to bone loss in the jaw, which can lead to tooth loss and dental issues. The jawbone supports the teeth, and when the bone density decreases due to osteoporosis, the teeth lose their grip in the weakening jawbone. Studies suggest that women with osteoporosis are 3 times more likely to experience tooth loss than those without osteoporosis. Check your dental health regularly. 11 risk factors for osteoporosis. As well as considering the early warning signs of osteoporosis, it's also important to know your risk factors. which can increase the likelihood of developing osteoporosis. These include 1. A family history of osteoporosis. Genetics may play a significant role in bone health. If a parent or sibling has osteoporosis, your risk increases. 2. Early menopause. Women who experience menopause before age 45 are at higher risk due to reduced estrogen levels. Estrogen plays a vital role in maintaining bone density by slowing down the activity of osteoclasts, the cells that break down bone. When estrogen levels drop, such as during early menopause, bone breakdown speeds up, leading to bone loss and increased risk of osteoporosis. 3. Being postmenopausal. Reduced estrogen levels after menopause can significantly impact bone density, increasing the risk of osteoporosis. 4. Breast cancer treatments. Hormone therapies like aromatase inhibitors or chemotherapy used in breast cancer can lead to decreased bone density over time. 5. Rheumatoid arthritis. Chronic inflammation and long-term corticosteroid use can contribute to bone loss. Studies have shown a strong connection between rheumatoid arthritis and osteoporosis, primarily due to chronic inflammation and long-term corticosteroid use. Steroids inhibit calcium absorption in the gut and increase calcium excretion, leading to reduced bone formation and osteoporosis. 6. Celiac disease. Celiac disease causes damage to the linings of the small intestine, which impairs the body's ability to absorb nutrients. This malabsorption leads to deficiencies in calcium and magnesium, both of which are critical for maintaining bone strength. 7. Substance abuse. Smoking, excessive alcohol use, and recreational drugs can all interfere with the body's ability to absorb nutrients, build bone mass, and regenerate healthy bone tissue. 8. Poor diet. A nutrient-depleted diet, especially one high in processed foods, can reduce the intake of vital minerals like calcium and magnesium, contributing to bone loss. 9. Thin body type. Individuals with low body weight, a thin frame, or have lost a significant amount of weight are more likely to experience bone loss. 10. Inactive lifestyle. Inactivity fails to load the muscles and bones, which means that they don't get the signal to make new bones as much as they should. The result is gradual weakening of the muscles, tendons, and bones. 11. Proton pump inhibitor use. A study published in the Journal of Bone and Mineral Research found that long-term PPI use is linked to a higher risk of fractures, especially in the hip, spine, and wrist. The reduced calcium absorption caused by PPIs contributes to this risk, as calcium is essential for maintaining bone strength. Pro tip: stop or reduce the bone saboteurs. So that's processed food, excess coffee, sugar, alcohol, stress, toxins, tobacco, sodas with phosphoric acid, certain medications like PPIs or omeprazole. Always consult your doctor first if you're wanting to change that, of course. And lastly, inactivity. The Royal Osteoporosis Society Risk Checker. Please follow the link and go online to assess your personal risks. How early intervention improved my client's bone health. I recently worked with a lady client who came to me with concerns about shoulder and neck pain. Naturally, she thought it was caused by her poor posture because she sat all day at her office desk. During our consultation, she mentioned feeling occasional spinal discomfort when bending over. And when I pressed gently on her mid-thoracic spine, she experienced noticeable soreness. The vertebral spinous processes were also particularly prominent under my fingers. Her medical history had already highlighted other risk factors, lack of exercise, and she was postmenopausal, which led me to recommend a DEXA scan. The scan confirmed osteopenia, lowered bone density, so we quickly got to work. She began a nutrient-dense meal plan rich in calcium, magnesium, vitamin D, trace minerals, and omega-3 fats to reduce inflammation. And we improved her general digestion so she absorbed those nutrients better. She started doing a Pilates class and 2 weight sessions in the gym each week. After just a few months and some good osteopathic treatment, she was more active, enjoying her healthier diet, and felt minimal discomfort in her spine. Her story is a perfect example of how subtle signs shouldn't be ignored, and early intervention can make all the difference. Pro tip: increase foods containing bone-building nutrients, dark green leafy vegetables, oily fish, nuts and seeds, dairy, pulses, whole grains, tofu, eggs, food high in vitamin C, and sunshine for vitamin D. How to prevent osteoporosis naturally. Preventing osteoporosis involves focusing on important lifestyle improvements, all of which focus on stimulating the body to make more bone cells. A healthy diet rich in vitamin D, calcium, magnesium, other bone-supporting nutrients, as in boron, vitamin K2, vitamin C, and omega-3s, are essential for maintaining strong bones. You can check if you are eating enough calcium in your diet using the International Osteoporosis Foundation Calcium Calculator, which is a great resource online. Consider your need for supplements like calcium. No more than 800 milligrams a day is the current advice, and vitamin D with K2. Ask me for advice on doses and good brands to choose. Regular weight-bearing exercises such as walking, jogging, dancing, or resistance training help to build bone mass and strengthen bone tissue. Specific weight-bearing exercises that target the back and core, such as planks, leg lifts, and back extensions, are great. Stretching maintains flexibility, posture, and agility. Reducing substance abuse, excessive alcohol, smoking, and drugs, and eliminating processed foods. Get regular screening through your doctor, especially if you have several of these risk factors or symptoms. Early detection through bone density scans, such as a DEXA scan, can reveal early signs of bone loss and help prevent further bone loss. A famous quote from Benjamin Franklin, an American polymath, a leading writer, scientist, inventor, statesman, diplomat, and political philosopher said, "An ounce of prevention is worth a pound of cure." Key nutrients for bone health. During a nutritional therapy consultation, I always check a person's diet carefully to ascertain if they are eating enough of the foods that contain these key nutrients to support good bone health. Calcium, 800 milligrams a day. Magnesium, 320 milligrams a day. Vitamin K2, 100 to 300 micrograms a day. Vitamin D, cholecalciferol, 1,000 to 2,000 IUs a day, that's international units. Vitamin C, 500 to 1,000 milligrams a day, time release. Omega-3s, 2,000 milligrams a day. In the table, you'll see food containing those nutrients as well. Conclusion. If you've identified any early warning signs of osteoporosis or risk factors discussed here, now is the time to take action. Osteoporosis can progress without obvious symptoms until a fracture occurs. The good news is that by recognizing the early warning signs and addressing risk factors, you have the power to protect your bone health as early as possible. Prevention is always better than cure, and early detection is key. Whether it's improving your diet, adopting regular weight-bearing exercises, or getting a bone density scan, every small step you take can significantly reduce your risk of fractures in the future. I encourage you to seek medical advice if any of these signs resonate with you. Don't wait for a fracture to occur, schedule a checkup, ask your doctor about a DEXA scan, and talk to a professional like myself for a tailored nutrition and exercise plan. Together we can build a stronger, healthier future for your bones. Stay proactive and empowered. Your health and you are worth it. Thank you.